Throughout our presentation this morning, friends, we have folks from, as Amit mentioned, from both Legacy and from Adventist here today. But in between all of our different presentations, we're very fortunate to have some critical CareOregon expertise to help set the stage and transition from one block of content to the other, and has been instrumental in putting this whole program together this morning and helping us really cement the idea of partnership between oral health and primary care. And that is CareOregon's own oral health clinical portfolio manager, Brittnay Trujillo. Prior to joining us at CareOregon in 2020, Brittnay's journey as an expanded practice dental hygienist herself allowed her to provide community-based oral health services across Oregon. Her diverse, both professional and personal experiences have cultivated a commitment to improving oral health care outcomes and advocating for more accessible care. Brittnay's current role here with us leads and supports oral health integration initiatives across dental, physical, and behavioral health, ensuring that there's alignment with CareOregon's vision and our goals to support our members and communities. She provides clinical coaching, development, and educational materials across the spectrum, fostering partnerships to ensure that oral health service delivery and oral health overall works. So enough of my talking. I've got busier things I've got to take care of now, thanks to Brittnay. So Brittnay, go ahead and take us away with your very first segment here, and we'll begin our program. Thank you.
Thank you so much, Paul, and thank you all for being here. I think Amit did a perfect job at setting the stage, and I don't even know if I need to be here anymore. I think we have what we need and we can move forward. But I will hang out for a bit and share a little bit of what we do here at CareOregon. And so, yeah, let's get into it and get started with maternal oral health. So really, Amit gave an amazing background on why we're doing this, and we're so fortunate to be able to bring this program to you today. Oral health integration is definitely my passion. I'm so grateful to be a part of this organization to move this work forward. Much of it was done before my time, so thank you to all the people that have been here for so long moving integration forward. But talking about oral health during pregnancy, even just thinking about when considering health, right? We could even back it up a few steps. And outside of pregnancy, just for everyone, that's a huge umbrella, health, right? It's important to recognize that it can encompass a wide range of meanings for different individuals. Even just thinking about yourself, what does health look like for you? If you really sat down and thought about that, what would that look like? What does that include? And that can be really dependent on where you are in life as well. Our experiences, familial beliefs, culture, trauma, and those social determinants of health greatly affect how and when we might seek care. And so how can we build those systems and infrastructure and continue to improve upon all the milestones that we hit here at CareOregon and throughout Oregon? One of the big steps is removing the traditional boundaries in healthcare for systems that can be significantly siloed like dental. So what was the first step? The new model, or first phase, was really getting oral health on the map. So finding ways to provide the support and resources to our networks in order for them to have the oral health conversations and pathways for educating their patients or whoever they're seeing. I know most of this will be discussion around oral health services in the medical setting, but it goes beyond that, much beyond that. So how can we help with education and navigation in other ways? And so to think about patient-centered care, to address those several aspects of social determinants of health, the promotion of practices and policies that can mitigate barriers and enhance access includes many individuals outside the traditional model that you see here on this slide. So we have behavioral health, we have medical health, and we have dental. But the strategies that include identifying specific roles that are instrumental in patients receiving care, I think we need to add a few to this graphic. And so this still doesn't encompass everything. And if you see something that you think of that isn't on here, definitely plug it in the chat. depending on your role or where you're working or the work that you do. Do you see a role that you could play in this? But we definitely need to include, community benefit organizations, traditional health workers. In this case, we'll be touching on midwives and doulas and interpreters. Transportation is huge. What other areas are missing? So again, very intricate, but it can be pretty simple. Again, that education piece and then having navigation pathways is going to be the most basic and significant areas that we can improve on moving forward. So possibly the most pivotal promotion in advancing oral health and prenatal care was back in 2011, the National Consensus Statement, if anyone's familiar with it. This is really spearheaded by the National Maternal and Child Oral Health Resource Center, was convened by HRSA, the Health Resources and Services Administration, in collaboration with the American College of Obstetricians and Gynecologists and the American Dental Association. That's all really a mouthful, but the statement really supports and provides the guidance for both prenatal healthcare professionals and dental professionals. So dental care during pregnancy is safe, it's effective, it's needed, it's necessary, but really the key points from the consensus that are still the standard today for prenatal care includes the implementation of oral health assessments as a routine part of prenatal care, education on the importance of oral health and the impacts on both maternal and infant health. So we'll touch on how it's kind of twofold, receiving oral health and having the oral health and dental care during pregnancy. And then really, again, reinforcing those referrals or care coordination, helping with that case management depending on the needs of the pregnant patient to establish a dental home, or they might be experiencing other oral health needs. I could talk for a very long time and I don't want to, I just noticed the time. So I'm going to breeze through a couple more slides. In keeping in alignment with the purpose of the consensus statement, the Maternal and Child Oral Health Resource Center provides updates on promoting oral health during pregnancy. These include activities, articles. They encompass a range of information such as recent research findings, basic practices, policy changes, education materials, success stories, and more. There is a link on this slide to those. They definitely aim to continue to keep healthcare professionals, especially prenatal healthcare professionals, informed about the latest developments and effective strategies regarding oral health during pregnancy. Just to touch on why there's a priority in prenatal oral health and receiving dental care, I'll start with the pregnant patient. So during pregnancy, there is a dual benefit or impact to both pregnant patient and baby, but addressing some of the prevalent oral health concerns pregnant patients may encounter and prenatal care providers may receive questions or concerns about, just due to the increased inflammatory and immune response during pregnancy. This really can exacerbate things like gingivitis. So having dental diseases like the gum disease can be definitely aggravated during pregnancy and more frequent in pregnant patients. Higher levels of certain hormones can increase this and also cause, due to other things like hormones, infection, certain things can cause overgrowth of tissue, so those pyogenic granulomas. Benign may need to be removed, want to keep an eye on things, but really important that home care and dental care is being received during pregnancy to reduce all these symptoms of gingivitis or pyogenic granulomas. The third being erosion and dental decay. So in thinking about pregnancy, dietary changes, eating habits may be significantly different, maybe experiencing morning sickness, amongst other things. So it can be very significant, and erosion and dental decay can be increased due to all these changes during pregnancy. So definitely want to get those routines established, if not already, by receiving dental care, understanding the importance of implementing other things aside from just brushing and flossing, as there's other things that can be done to prevent these issues during pregnancy. The other part of the twofold is the upstream approach to reduce the child's future risk of dental decay. So we've touched on this, Amit touched on this, even Paul, we have Paul really upskilled on oral health integration. So he's even doing a great job at setting this up for us. But discussing oral health with patients and them having that support really sets them up for success by screening, educating, and referring. I'll be repeating that all through my content. But to ensure they're establishing a dental home, this can help adopt those healthy behaviors, understanding the importance of how their own oral health relates to their children's oral health, and then adapting those healthy behaviors for the entire family can result in better outcomes for the child. Receiving dental care during pregnancy can reduce the bacteria load and reduce the amount of bacteria that will be passed on to baby once they arrive and throughout the future. So definitely important to see oral health over the lifespan. So before baby is born and then through adulthood, and then hopefully this continues throughout. Just to share some quick little data. So even though dental care has been proven to be safe throughout pregnancy and effective in improving health, as you can see from 2018 through 2023 here, or more so through 2021, yes, the public health emergency definitely impacted all of healthcare across the board, but we've seen a decline in pregnant patients receiving dental care. And so we really wanted to look at this and develop some initiatives around maternity and oral health and build that infrastructure and organization-wide development of programs here to improve this. So we have our dental care request, which I will touch on at a later point, but we built that out initially. And then maternity list sharing. So one of the difficulties of the health plan can stem from not being able to identify pregnant members until after delivery. So how can we be more informed on which of our members are pregnant? So having that secure data transfer with our partners has been huge. And then our dental plan outreach and care coordination is very significant as well. Those organizational wide programs. So what I get to kind of implement here at CareOregon, developing our resources for partners, providing training for partners, and technical assistance and support on those workflows. And again, data sharing is very important. We want to provide our network with the best information and resources and assistance we can to make this as smooth as possible and as easy as possible to implement. We will be having a provider brochure coming soon. I'm looking forward to creating that here in the near future. But we do have member materials currently that we share with partners. And lastly, before I send it off to Legacy, I just wanted to share that we also did create an oral health integration toolkit for maternity. The link is here on the slide and will be shared out later, but this really encompasses what we can offer here for prenatal providers. It comes with implementation checklists, oral health screening examples, all of our resources, and other support within the toolkit. So it really shows and encompasses the entire work that we do here and how we can support our network. And it can even help individuals and organizations outside of our network. So we love to share that with folks, and hopefully you can glean something from that as well. And with that, I will pass it over to Paul to introduce our next guest.
Thank you. That's really, really an excellent way to set things up here for us and talk about the work that's going on. And as I mentioned earlier, Brittnay will be back at several other stages throughout our presentation this morning to provide even more context for some of this work.